Hi, my name is Kelly Ward, and today I'm going to be presenting a teaching strategy to you called simulation. This assignment is in partial fulfillment of N5309, Teaching and Learning Theory, Strategies, and Evaluations at the University of Texas at Arlington. Simulation is the creation of an interactive learning environment for students. So in a simulation activity, you would create an environment that is much like the environment in which a situation would occur. If the situation is a critical thinking environment with a patient, you would use maybe a hospital room and a really high-tech trainer that could respond like a patient. So in this specific scenario, we're going to be teaching a patient safety handoff. So we won't require any trainers or any additional equipment, but we will have students that are participating as the patient and participating as the caregivers. It's very important when you're doing simulation that you make sure that you create an environment that has medium to high fidelity, especially when you're talking about critical thinking skills. If you're practicing something very basic like an IV start or just a simple task, you can use simple trainers. But as you get more complex and you want people to be able to use their minds to make decisions, the fidelity of the environment is very important. And I'll give you an example of this. Some of us who have been nurses for several years can remember going through ACLS classes. ACLS used to be very, very difficult because in your mega code, the trainer that was used was very basic, and this was before all these high-tech trainers were really available in the clinical settings. So the instructor would tell you all these details that you needed to remember about the patient. They're bleeding out of their chest, they're gasping for their breath. So the learner actually had to remember all these details as they were trying to critically think through the situation. And the visual didn't give the learner the details that they needed to be able to just focus on the critical thinking aspect. So now when you go and take ACLS, they have very high-tech trainers. The trainers make sounds, they breathe, and it really takes that other anxiety-provoking process off of the learner where they just look at what they see and they can make decisions based on what they're seeing in that situation. So, most important thing, creating the right environment for learning for simulation activities. For the purpose of this discussion, I'm really just going to focus on showing you the simulation technique that's being used to teach the concept. I will just give a brief overview of the concept itself so that you can understand how to apply the concept as you're watching the simulation activity. I do want you to consider, though, when you're doing simulation, there is some preparation that needs to apply. So, of course, you would want the content to be taught to the student first in a classroom type setting, maybe using a PowerPoint, something that will instruct the students as well as reinforce that the education was understood before you want to go into the simulation environment for practice. In this situation, I would use a PowerPoint presentation to introduce the mnemonic for the safety handoff, and then I would do some sort of participatory activity like throwing a ball into the crowd and letting them explain how they would apply the concepts in real life. The instructor may also want to go the extra step and actually act out the simulation before they have the students practice. This is a basic overview of the vitals handoff communication process that we'll be simulating. The V stands for verification of the patient. This uses two patient identifiers and would include the patient in the identification process if the patient is alert and oriented. Illumination is the next step in the handoff process, and to help enhance the education with the learners, we've also provided a pin light for each student that they can use to make sure that they have proper lighting to ensure patient safety. Tracing all tubes and lines to ensure that the proper assembly and the proper connections are in place is the third step of the process. The A stands for assessment. The caregiver needs to assess A, B, C, and D. This includes airway, breathing status, circulatory status, and deficits, which would include alertness, and orientation. The L reminds the learner to listen actively, giving their undivided attention to the communication handoff process. There should be no computers in the room. Everyone should be looking at each other and making sure that they're listening and asking the appropriate questions. And last but not least, we have safety. Safety concerns that can be brought up should include those like fall risk, the patient's ability to ambulate, any medications that have been given recently that may make the patient drowsy or altered, anything that the caregivers find relevant as far as safety concerns exist. Okay, we're here in our simulation classroom, and I have Jennifer and Shelley here, and they are going to go through a patient safety handoff using the vitals technique in a simulation activity. This is our patient. This is a 63-year-old diabetic who was admitted to the hospital, and you're handing off from a shift-to-shift report.
Good morning, Miss Williams. It's Shelley again, and I'm actually getting ready to leave to go home, but I brought my replacement, Miss Jennifer. Jennifer's been a nurse here for 9 years, and she's going to take really good care of you. While we're here, we're going to check some things for your safety. So we're going to start off with looking at your identification band, okay? Miss Jennifer, this is Miss Betsy Williams, medical record number 34567, date of birth 11/24/72. Miss Williams, we do have you on fall precautions due to some of the pain medications that you're on. So she has her fall ID band on. Side rails are up ×3. And I've got the bed alarm activated for her safety.
And the bed is not good.
Yes, ma'am. While we're here, we're going to take a look at your IV side as well, just so Jennifer can take a look at it and make sure that it's functioning appropriately. Jennifer, we've got normal saline. It's going at 125 for her hydration. She does get intermittent antibiotics. This is the left antecubital. It's 2 days old. The date and time is on there. Site looks very good. IV is patent.
Good.
She also has a Foley catheter. We inserted that during OR procedure. So if you take a look on that side, you'll see she's draining clear yellow urine. And we'll trace that up. I'm going to uncover you for just a moment. It's secure and safe. I've already documented her output, which is very, very good. Today we'll be switching you to a soft diet and see how well you tolerate that. Do you have any questions for us at this point in time?
I didn't see a label on the Foley. What date was that put in?
It was put in yesterday during surgery, so we'll make sure when we go back out to the front that we'll label the Foley catheter and put that in there. Okay, thank you so much for your time. You have a wonderful day. It was my pleasure taking care of you. Before I leave, are you comfortable in the bed?
Yes.
And do you have any pain? On our pain scale, where is your pain?
Oh, I'm good.
Okay, wonderful. Here's your call line. Here's your phone. So if you need anything, Jennifer's going to have the same number as myself. Please don't hesitate to give us a call. Thank you so much and have a great day.
And I'm going to go outside. I'm going to look at your orders and I'll be right back, okay? Thank you.
Really good job, guys. So just a few things to point out. I like the way that you guys actively listened to each other. You didn't have any distractions in the room. Did you feel comfortable practicing that handoff?
I did.
Yeah.
And you felt comfortable being a part of that handoff?
I did.
Okay. Is there anything that you would do different?
No, I think it went really
No?
good.
All right. That is simulation, and that is how you practice teaching strategies in a real-life teaching environment. You can use a trainer or you can have a real-life patient when you're doing this.